For those of you who don't know me, my name is Meg Marquetos. I'm the Director of Business Development and Member Services here with the Chamber. Thank you for joining us this morning, and welcome to our first Women in Leadership session on beating inequality and all about women's heart and brain health. For the next 45 minutes, we'll be discussing the importance of women's heart health and their unique risk factors from our guest speaker, Donna Bedell, Manager of Community Programs at Heart and Stroke. There will be a question and answer period moderated by Carla Nell, President and CEO of the Chamber. And then we will break into some networking rooms for some additional discussion and networking. And before we let you go, we'll bring everyone back together to wrap up. Let us get started. Today, I have the pleasure of introducing the sponsor for today's event, Lena DeMarco from Community Affairs at Bell. We're very fortunate to be able to bring you today's session on behalf of our partners at Bell. Thank you, Lena.
Thank you, Meg, and good morning, everyone. My name is Lena DeMarco, Regional Director, Community Affairs at Bell. I'm very pleased to be with you and represent Bell at this morning's event. Bell is proud to partner with the Burlington Chamber of Commerce and offer the Burlington business community sessions that speak to the importance of maintaining and promoting good health. And before we begin today's event, I want to take this time to thank all our elected officials at the municipal, provincial, and federal levels for their hard work and dedication during what was likely their most challenging year in office in the midst of a global pandemic, and as well to thank all the frontline workers for your dedication and support during this very difficult time. At Bell, we have been committed to doing our part to help Canadians as an essential service during COVID-19. We know how many people and businesses rely on our world-class networks, and we are proud our network has supported an unprecedented surge in demand. In addition, we have further increased capacity to ensure service availability as well as heightened support for organizations providing critical services. And now I have the pleasure of introducing our guest speaker, Donna Bedell. Donna has been working at Heart and Stroke as the Manager of Community Programs for 5 years. She knows firsthand how Heart and Stroke directly saves lives. Almost 34 years ago, her own father suffered a near-fatal heart attack, and although his heart was permanently damaged, thanks to a pacemaker and defibrillator, he has gone on to live an active and healthy life, celebrating with his children, grandchildren, and even a grandchild. Donna is passionate about helping others like her dad, but also advocating for change to improve the lives of all Canadians and educating people on the importance of creating healthy habits, eating well, and getting plenty of exercise. And today, taking charge of her own health so that they can live long and healthy lives and prevent heart disease and stroke from disrupting their lives. Please welcome Donna.
Thanks so much for that kind introduction, Lena. And thanks also to Bell for sponsoring this event today. I'd also really like to thank the Burlington Chamber and specifically the Women in Leadership Committee for inviting me here today to speak on this important topic. Next slide, I guess.
You want to unmute?
Okay, great. So let's get to it. So what really is the issue here? Well, quite simply, it's that women aren't able to access equitable healthcare because the system was not designed with them in mind. We all have women that we love in our lives, mothers, sisters, friends, daughters, daughters-in-laws, wives. Women, we're at the heart of our community. We also know that COVID has disproportionately affected women. They've experienced higher rates of exposure to the virus, higher rates of infection, and they've borne the brunt of limited access to childcare programs, the additional mental health strains that brings. They're also taking care of children who are now schooling at home and may also be taking care of elderly parents. Can you advance the slide, please? So here's a shocking statistic for you. Every 20 minutes, a woman in Canada dies of heart disease. It's also the #1 cause of premature death for women in Canada and the leading cause of death for women around the world. Heart attacks are more deadly for women than men. So it's time for us to take control of our health and break the glass ceiling on heart health. It's time for us to correct these inequities that claim the lives of too many women. Can you advance the slide? So the question remains, are women's hearts really different from men? Well, the answer is yes, they are. And women's lives are different too. Women's hearts are smaller, heart disease may develop differently, and their hearts are affected by hormones during pregnancy and menopause. Our lives are different too. We play many different roles. We're small business owners, we're presidents, we're CEOs, we're fundraisers, we're nurses, we're doctors, we're lawyers, but we're also nurturers and caregivers. And those are deeply connected to our identities. And that means that we often deprioritize our health to take care of the other people in our lives. We also have gender-based differences that may increase our risk. We have lower socioeconomic status and greater family responsibilities. These are all interrelated and they're prevalent among women. Next slide, please. So today, when it comes to heart disease, women are under-researched, underdiagnosed, undertreated, undersupported, and underaware. That's a whole lot of unders. And this complex mix begins with research, where for decades, specific therapies were tested in controlled studies, typically on middle-aged white male subjects. There was an incorrect assumption that one size fits all. In fact, 2/3 of heart disease clinical research has been conducted only on men. And we know that treatments don't work the same way for men and for women. Next slide, please. So women are underdiagnosed and they are undertreated. We know several standard diagnostic tests for heart disease are actually less sensitive for women. And what this means is you may get a misleading diagnosis that leads to delays in treatment and increases in return hospital visits. In fact, women are 4 times more likely than men to be readmitted for chest pain within 6 months. They're also less likely to receive care from a cardiologist or to be referred for diagnostic tests or treatments. We also have more adverse reactions to certain heart medications, and these reactions are more severe than what men will experience. Women also have twice the risk of bleeding complications from common treatments such as angioplasty. Next slide, please. So let's get right to it and talk about the signs of a heart attack for men and for women. Are they really different? Well, the answer to that question is yes and no. The no part is that for a lot of people, they will experience chest pain as the first sign of a heart attack. But typically when we think of a heart attack, right, we think of it as that sort of Hollywood version, you know, a white man usually clutching his chest and falling to the ground in pain. Well, in fact, women may experience far more subtle signs of a heart attack. They can experience a heart attack without any chest pressure at all. Also, women describe it differently. They really use the word pressure instead of pain, and this will lead to different outcomes when you present yourself in an emergency room or to a doctor. So let's get to it and talk a little bit about what that might look like for women. So again, as I said, it's often not a pain so much as a discomfort. It can be in the chest, but not always. It can feel like this pressure, a squeezing, a fullness, a burning. You know, often it's described as indigestion as well, right? There's that heavy sweating that comes with it. There's also, and this is quite common in women, instead of a chest pain, it's discomfort in the upper body. It can often take place in the upper back, the neck, the jaw, shoulders, arms. They will experience nausea, shortness of breath, lightheadedness, dizziness, extreme fatigue. These are all signs that you may be experiencing a heart attack. I'm going to tell you a story about a constituent of mine. We've become quite close over the years. She's a volunteer for me. She's a survivor. We were at an event once and she said to me, "Donna, do you want to know what it felt like for me when I was experiencing my heart attack?" And I said, "Sure." She took her 2 fingers and she put them in the center of my upper back in between my shoulder blades. And she pressed ever so gently, like it was a slight pressure. And she said, that's what I was feeling. I went, wow, okay, it doesn't feel like much. Like it really didn't feel like much. But she said she was experiencing it for a few days. So it was kind of like a nagging, annoying feeling. What drove her to call the doctor, though, which she actually called telehealth, was she was also experiencing shortness of breath. Now, she was an athlete, so this shortness of breath that she was experiencing was unusual for her, right? She was like, it was strange. Her initial reaction, of course, like all of us, right? She decided, I just need to exercise more. Well, that clearly didn't work. She was still short of breath. So that led her to call telehealth. So she calls telehealth and they advise her to go to the emergency room. Her initial reaction to that is, and I quote, "I can't, my husband's eating breakfast." I got to tell you, that is not a shocking thing that we hear from people. Again, we're caregivers, right? I can't go right now. I'm busy. Anyway, she did present herself to the hospital later that day, and she was in fact having a heart attack. Now, as it turns out, in this particular case, she was subsequently diagnosed with a very severe form of heart disease that advances from often from diagnosis to death is a period of 6 months. 5 months after she presented at the hospital, the day after Mother's Day, she was in the hospital receiving a new heart. So imagine, had she not called the telehealth that day, had she not presented at the hospital, what the outcome could have been. So I am here to tell you not to ignore symptoms like this. I get it, right? I'm in menopause right now. I sweat all the time. I have these hot flashes, right? And we're busy people, right? Guess what? We're tired right now, right? We've been battling COVID for 15 months. We're battling businesses. We're battling with we've got kids at home. We've got aging parents. I get it. But we also know our bodies and we know when things are different in our bodies. So what I'm here to say is when you're noticing these differences in your body and they feel different and they're happening over a period of time, and by a period of time, I mean 1 or 2 days, you need to pay attention and you need to stop saying, I'm too busy. I've got to get, I got to help Johnny with school. I've got to get dinner on the table. I've got to clean my house. No, you need to go to the hospital and you need to get this looked after. Next slide, please. All right. Another shocking statistic is that women are 50% less likely than men to participate in cardiac rehabilitation. And what's not good about this is we know if people participate in rehabilitation programs, they have far better outcomes, both physically, mentally, and emotionally. And again, their lack of participation in cardiac rehab is due to a number of factors. A lot of them are socioeconomic, but it also starts with the fact that they're actually less likely to be referred to cardiac rehab programs. Women are also more likely to experience depression. They again have greater home and caregiving responsibilities, which makes them less likely to participate, and they're often living in poverty. If you can't get to cardiac rehab because you can't afford the transportation to get there, you're not going to participate. Again, another story I'll tell you, I had a volunteer who worked for me at the Halton office when it was open, and she had a heart attack in her mid-50s. And she did go to cardiac rehab, but she was the only person, the only female there amongst a sea of men. And she said to me, she said, I know exactly why that was the case. I said, why? And she said, because it took place at dinner time and all the other women were home, putting dinner on the table and taking care of their families. So, by making sometimes simple changes, we can change accessibility, right? So, these are things we need to think about and talk about. Next slide, please. So here's another, this slide always kind of gets people, right? Here it is. Women are 5 times more likely to die from heart disease than they are from breast cancer. We fear cancer. We fear these diseases sometimes more than we fear what is actually, like I said earlier, the #1 cause of death, premature death for women in this country. you know, and what happens too is, again, women will downplay their risks. They're not aware of their risks. And at the same time, we did a survey here at Heart and Stroke, and only 1 in 5 women ever have a conversation with their doctor, or their doctors regularly talk to them about their heart health, right? So again, it's something that we need to raise the awareness of, not just within ourselves, but within the medical community. And, you know, kudos to breast cancer. Kudos to what they have done to actually raise that awareness. It was top of mind for a lot of women. And as a result, we've seen a continuous decline in the death rate, right, of women dying from breast cancer. And that's an awesome thing. We now need to turn our attention to women's heart disease and see that same kind of thing start to take place. Next slide, please. You can put it down again, Shauna, just to bring up, thank you. So now I'm going to talk to you about the signs of a stroke. And first of all, let me just say that stroke is a medical emergency, and that's a good thing. 20, 30 years ago, it wasn't considered a medical emergency because if you had a stroke, your outcomes weren't great. Now it is, and if you experience any of the signs that we're going to talk about, you need to call 911. Don't drive to a hospital. The reason is, again, through work that the Heart and Stroke Foundation has done, quite frankly, we have one of the best models of stroke care in the world. Canada is actually a leader in stroke research. And as a result of this, when you dial 911 and the ambulance comes, they'll start triaging you right away, but they will take you to a specialized hospital whose specialty is stroke care. Here in Halton, we're lucky. We live, like Trillium and Hamilton Health Sciences both have stroke centers. There will be a team of people ready to receive you. They will give you all the care that you need, and you will have a much better outcome. So let's get to the signs of a stroke. We use the acronym FAST here at Heart and Stroke, and it stands for face. Is it drooping? Is one side up, one side down? That's a sign you could be having a stroke. Arms, if you put them out in front of you and one drops, that's a sign you could be having a stroke. Speech, is it slurred or jumbled? If you're speaking and it's all garbled, that's a sign you're having a stroke. And most importantly, as I mentioned, is T for time. We lose 1.9 million brain cells a minute following a stroke. So the quicker you can get to the hospital, get the drugs that you need and get the care that you need, far better outcomes that you're going to have. Now, while the signs of a stroke are not different for men and for women, stroke disproportionately affects women. More women are living with stroke than men. Women have worse outcomes after a stroke, and more women are living with effects of stroke and more challenges as they recover. And again, as we've talked about, women's bodies, we're not little men. We are different. And as a result of that, we have different risks at different stages in our lives. First starts at pregnancy. The risk of stroke increases during pregnancy. It's still small, but it's there, especially if you're diagnosed with preeclampsia. I was diagnosed with preeclampsia with my daughter 23 years ago when I was pregnant with my daughter. Nobody talked to me about stroke. Now, it was 23 years ago, but I have a history of stroke in my family, and nobody asked me about it. 2 of my mother's female cousins died of stroke in their mid-50s. My grandmother died of a stroke, and 3 of her sisters died of a stroke, all women. Nobody asked me about it. And I'm a type A personality, right? I had preeclampsia. I'm supposed to slow down. I was in the middle of a company I worked for had just been acquired by IBM. We were in the middle of selling my business unit. I was totally involved in that process. And I wasn't going to slow down. I shudder to think about it now because I really didn't take care of myself and I didn't understand the risks. Now, thankfully, my daughter was safely delivered a month early because she had to be taken early because of my preeclampsia, but it was all good and I was okay. But, I think about that now and I'm like, wow. Again, during menopause, women are also at greater risk. And they're disproportionately affected as they get older. Women of an older age are more likely to have strokes. Their strokes are the most severe, and it leads to a loss of independence for a lot of elderly women. And also, because our lives are different and women are used to being caregivers and are often seen that way, they're not taken care of in the same way. And they don't often get the supports that they need, and we don't always ask for it either. Many women, unfortunately, are not aware of what a stroke is, and many women don't understand the fast signs of stroke. You know, we've tried very hard at the Heart and Stroke Foundation to bring these fast signs to the marketplace. We educate children on it in our Jump Rope for Heart programs, and we are raising that awareness, but there is still a lack of it out there. Groundbreaking research also suggests that more women than men who are experiencing TIAs, so these mini strokes, so you'll see some of these symptoms and they happen very quickly and then they go away, may actually be experiencing a full stroke. We're doing research on that right now, but that's continuing, but it's also something to look out for. Next slide, please. And you know, the risk is even greater for some women. Indigenous women face a 53% higher risk of coronary heart disease, and they also face a critical gap in accessing the care, the diagnostics, and the treatments that they need. They're also twice as likely to die from a stroke than non-Indigenous women. And women of South Asian, Chinese, and Afro-Caribbean descent also have higher risks due to pre-existing conditions such as diabetes and hypertension. Next slide, please. So sex and gender blinders have caused too many women's lives to be cut short. And it's going to take all of us working together to break the glass ceiling on women's heart and brain health. We need to ignite a passion. We need to inspire people. We need to, you know, talk to our governments, to get our healthcare workers involved, to have systems leaders, to have an organization such as ours to really move the needle on this. Next slide, please. So what is Heart and Stroke doing to improve women's heart and brain health? So we're investing in research that has a sex and gender lens now. We're not funding any research that doesn't have that. And we're integrating equity, diversity, and inclusion throughout the research that we do. We're advocating for change constantly with our federal and provincial governments. An example of that would be the National Pharmacare Program, which we know, again, disproportionately affects women. You know, I hear all too often from constituents who ration their daily medications. You know, they'll take them every second, third, or fourth day because that's what they can afford to do. You know, we're educating healthcare professionals. We're investing in the national medical community. We're highlighting women's specific differences. We're constantly presenting the research that we find on this to medical organizations, to bodies. We're big part of the stroke best practice guidelines. Again, they're some of the best in the world. We're building awareness, ensuring that all Canadians are aware of these unique realities. You know, we have had national advertising campaigns in place, and we're also working to support recovery by facilitating communication amongst women with lived experience and their caregivers. We have communities of support that really help with that. And we just recently, last week, actually announced a partnership with the March of Dimes Foundation to really kind of help in stroke support and rehabilitation. Next slide, please. But we need help, you know, to significantly increase our impact and truly change women's health in Canada. Canada needs a national strategy, and that's going to get the help from, you know, from lots of people, right? We need the governments to get involved. We need targeted awareness campaigns. We need more professional education. We need more prevention and recovery support. You know, and here at the foundation, we're fundraising to try and raise more funds to put towards this specific effort. Next slide, please. So what can you do to take charge of your heart and brain health? Well, like I said before, the most important thing you can do is to really trust your instincts, understand your risk, and talk to your doctor. And again, I'm going to say it again, put yourself first. Don't ignore changes that are happening to your body. You know, and, you know, whether it's heart attack, stroke, or other things that may be happening, right? You need to pay attention. We as women need to prioritize ourselves, right? It's that whole oxygen mask analogy when you get on the plane, right? You put it on yourself first before you put it on somebody else. You know, you love the people in your life. You need to be here to take care of them. So I'm here to tell you, put yourself first. Talk to your doctor, understand your risks. We actually have a checklist. If people are interested, I can get it out to the chamber and we can send it out about how to talk to your doctor, how to prepare for a doctor's appointment. You know, what are some of the things you need to be aware of so that you're not forgetting when you get there? Because often we feel rushed when we get into a doctor's office, right? You know, and all the things you thought you wanted to talk about, you leave and you go, oh, you know, I forgot that. We can help with that if that's what you want. Use your voice. You know, share what we've talked about today about heart attack and stroke and the signs and how they're different for women. You know, if you want to get involved with us, if you want to get involved in this specific issue, I'd love to talk to you about that and see how you can help support us. And if you'd like to donate, you know, you can do so at heartandstroke.ca. That would also help us to obviously close the research gap. Thank you so much.
Oh, thanks so much, Donna. That was such a terrific and insightful presentation. We're so grateful to you for that.